Hi, my name is Suraj Kumar Lachmandas and I'm the founder of MiMIAT. And welcome everyone to the sessions called Coffee with Experts, in which I will be interviewing professionals from different sectors in order to get their expertise and knowledge regarding gut health. In this very first episode, I will be interviewing our CMA, our Chief Medical Advisor Pedro, who will be shedding some light especially on the topic of habits and the importance that they play in regarding gut health. So let's deep dive into a conversation with him with a cup of coffee. Hi everyone and welcome to the first episode of Coffee with Experts. And here we have today Pedro in the first session of this brand new series. And he is our CMA of the CMA of MiMIAT. And thank you very much, Pedro, for being here today. And some of you might already know that he is directly being involved in refining the product of MiMIAT, the app that we will launch at the end of this year. So Pedro, tell us about yourself. What do you have to tell to the people that are listening to you?
Well, thank you, Suraj, for having me here. It's a huge pleasure. Um, just to present myself a little bit, my name is Pedro Martin, and I'm a family doctor in the Spanish National Health System. I'm working right now in the north of Spain, in the Basque Country, and at the same time, I'm trying to help you as much as I can developing MiMIAT.
Yeah, and super grateful to you because at the end of the day, we want to build MiMIAT as a strong product, and that is why we need the experience and the guidance of such amazing professionals such as you. So the first episode
Thank
of
you,
Coffee
Suraj.
with Experts is, as you already know, that is meant to be to get insights from them, and we wanted our CMA to bring a topic that he would like to speak about. So which topic are we going to speak about today, Pedro?
Today, I wanted to talk about habits and their importance in the gut health.
So what do we mean by habits when we are talking about general health? I mean, what are they?
I think we could define habits as mindless daily activities that we do as we go through our days. They're usually mechanic, automatic, and they just come and we do them without thinking. So it's good to, I think the key is to measure them properly, you know?
So could you give an example in general health? I mean, not only for like digestive issue people, but in general health, what could they be?
General health, the most important ones would be sleep, diet, and exercise. I think they would be the three, pillars of health, let's say. So the more you can measure these habits, the better you can understand yourself. Because what you don't measure, you really cannot work upon, improving. So yeah, those would be good examples.
And what role do they play? I mean, when we are speaking about people with digestive issues, so as you already know, that MiMIAT is focused for people that are having any digestive issues. So it can be IBS, IBD, GERD, or any kind of other conditions that are existing. So what are habits specifically for them?
Mm, well, I think they're the most important one, the most important part, because you really cannot change your genetics. Whatever cards you were dealt at the beginning, you just cannot change them. But you can work on your habits. You can improve your habits a lot. I've seen huge changes in people with the proper guidance, the proper motivation. Habits is a huge percentage of any disease, not only digestive tract diseases, but any. On certain diseases, also supplements might help a lot, besides habits. But I'd say the foundation is always habits.
Okay, so from 1 to 10, if you had to rate the importance of having habits at when the person is beginning with a digestive issue. So for example, let's put an example of a person called Alex, and Alex is starting,
Okay.
for example, with any sort of condition. So at the beginning, very at the beginning stage, when the doctor tells him that you are starting with this condition, from 1 to 10, which score would you give it to tell that the importance of habits on that time?
I'd say a nine. A
9.
nine. Because,
Why?
I mean, certain things are very dependent on your genetics. That's true. But still, this Alex, the only thing he can do to fix his disease, besides, of course, following guidelines, taking the medication, is changing his habits. I'm pretty sure that if I could talk with Alex for a while, we could eventually realize which part of his habits have made him develop this disease. So if you're able to work on that, you have a huge percentage of chance of getting better. So I'd give it a 9, absolutely.
So also, as you mentioned previously, diet also plays an important role in that sense. So obviously, when a person starts with a digestive condition, sometimes you don't know, how to manage diet, because at the end of the day, there are some foods that might trigger you some symptoms, but at the end of the day, it becomes quite difficult. So is there any kind of, I mean, as we are speaking to the general population, so it can be any person with any kind of condition, is there any specific type of foods that can actually trigger like inflammation, as we talk about, or gut discomfort in general speaking?
hmm That's a very good question, and one that is hard to answer because there's a lot written on diet and a lot of web pages that will tell you one thing and another. So I think that for this you need to be, with a proper guidance. But talking about general principles, for example, if you're talking about gastric reflux, it's very common that fats will give you problems, tomatoes, spicy food, chocolate, things like this. Or if you, for example, are thinking of irritable bowel syndrome, in this case, is mainly FODMAPs, which is a type of sugar that certain foods have. For example, onions or garlic, typically wheat or dairy products. All of these legumes can be very very problematic for these patients. Yeah, they are the most common. Whereas in I always confuse IBS and IBD. In IBD, I think you need to take care of many more things besides food. So lactose and gluten might be a problem, but you also have to take care of your sleeping patterns, of your mind. There's a few more things in there.
So a tricky question for you. So as you already know that these conditions mm, are happening in different cultures, so this is not something that any specific region is focused on that condition. So
Absolutely.
for example, if there are certain foods that are actually very ingrained with certain cultures. For example, in India, and myself speaking with a person of being a person with IBD. So, for example, we eat chapati. So these are the kind of foods that you're already aware of them. So these are kind of, so much ingrained in the culture that it's sometimes difficult to leave them, because at the end of the day, this is being something prepared at home, or these are the types of food that you cannot skip. So, what suggestion do you have for them? Like, which are the ways to cope up with that? Especially as you were mentioning that gluten can be a potential trigger, lactose can be a potential trigger. So, these are sometimes these kind of foods that can actually, be difficult to
hmm
detach them from that person. So, what suggestions would you have?
Absolutely. I know this pretty close because before I was a doctor in Raval, and everywhere we attended a lot of people from Pakistan, from India, and as you say, chapati, dal, which is the lentils. It's a huge part of their diet. So it's very hard to someone from Asia to tell them to not take this sort of foods. In this case, I usually start treating other things, because usually if you don't have inflammation in your gut, you might be able to take certain amounts of food and digest them properly, even if it's legumes or if it's wheat, gluten, as you say. So I might start with a more holistic approach and talk about stress, talk about sleep, talk about certain supplements that might help with the inflammation in the gut. And at the beginning, at least for the first week or 10 days, it's very necessary to reduce the amount of wheat or of lentils as much as it's part of your culture. But eventually you'll be able to tolerate quantities of them more and more as you get better.
So it's certainly difficult to create habits, especially when you go to the doctor. So if we go to Dr. Pedro and Pedro tells us, okay, now you should quit like chapatis because they contain gluten. So it's certainly difficult to create habits, especially when this is something part of you, right? So
Absolutely. And of your
how,
culture, as you were saying.
exactly. So how do you manage that cultural shock? Because probably people come to you and say, "Yeah, but as even when you told me to do so." But do you say, how do I do that? Because in India, it's not common to find these kind of products, at least specifically not gluten, not lactose, when they are so much ingrained in our cuisine.
Absolutely, absolutely. It's a hard one. It's a hard one because there are certain habits that are ingrained in the culture of the person. They are part of who he is or who she is. So, with regards to this, I try to measure as much as I can the motivation of the patient because there's at the beginning there's going to be a bit of pain, a bit of friction, until you're able to change a bit, until you can get better and tolerate these quantities. So you need to be quite motivated and quite willing to take the plunge, to get better. Whether you're from Pakistan or from Spain, I mean, people here, where I'm working now, they take a lot of pinchos, which is tapas, typical like a piece of bread with something on top. And this is part of the culture, taking a few wines or a few beers is absolutely as important to them as it is for you, the what we were talking about, the lentils and the chapati. So at the beginning, it's just necessary to go through a bit of discomfort, but it's definitely worth it, worth the pain.
So now, continuing with the example of Alex, for example, so now imagine that he starts with the habits, he listens to the advice that you give him, but again a few weeks afterwards he sees no result, he still has gut inflammation or discomfort,
Hmm.
or he's still feeling that even though I've applied the changes, but certainly I'm not seeing the results. So how long generally, I mean, as you have experience with this, how long does it take to actually see the results by itself?
Hmm. Well, it depends on different factors. Like if it depends if it's a chronic condition or an acute condition. So if you have, let's say, IBD or if you have a celiac disease, for example, a flare in IBD, as you well know, it might take weeks to resolve. So for you to get better, it might take even a month or 2 months because you have to change a few things. Whereas in acute conditions, for example, like IBS or gastric reflux, you usually feel the difference in 1 week, 2 weeks. If you're doing the appropriate thing, like reducing FODMAPs or taking care of your stress, which is a huge part in IBS, you'll feel the difference pretty soon. You don't take as long as other diseases. But it also depends on how long you have had this disease. If you've had it for 10 years straight, like continues, then maybe you'll take a bit longer. But you have definitely more chances of getting better in these acute ones, you know?
So what do you suggest, for example, these kind of people, or at least this kind of profile of people that have these kind of conditions?
Hmm.
Sometimes at the end of the day it becomes difficult, especially because, as I mentioned, that due to these kind of reasons, because they don't see the results, they end up quitting these kind of good habits. So what kind of techniques or suggestions do you have for them to actually not quit and to be persistent on that note?
Mm. That's a great question. So I think many books have been written on that topic because it's a pretty hard one. Like for us, especially in the medical world, it's very hard for people to stick with habits in the long term. Very, very hard. Weight loss, digestive tract, whatever you name it. I think that you can try to hack your behavior. If you're really motivated, I would definitely suggest that you see an interview online by James Clear, the writer of Atomic Habits, and you learn a bit on how your brain works in this sense, in the habit sense. And you get to know what's your, let's say, your weak spot. So for example, for me, I know that I'm able to do a streak, and I have these habits pinned down, and suddenly a few days I stray away. It happens to everyone. You have a wedding or you have vacation. It's very important that you come back as soon as you can, even if it's just, I don't know, 5 minutes. If you're trying to, I don't know, start running, come back as soon as possible, as little as possible, so you keep on, on the inertia, on the streak. Otherwise, if you start leaving it, eventually you'll find it very difficult to come back. So this is one of the ideas that this guy gives. He's really, really good, and I would urge anyone who has wants to know more about this to one of his interviews or the book, of course.
So on that note also that you are mentioning this, once the damage is done, for example, this person, this Alex,
Hmm.
who is our example, he doesn't listen to you, he keeps his lifestyle, diet, and these kind of patterns of life the same as previously, that before before having this digestive issue.
Pretty
So
common.
so which can, obviously certain damages can happen. So what kind of notes you have on that aspect? So
Mm.
basically, can they be reversed, or is it something that there is no going back?
Again, it really depends on the severity of the disease. So, for example, if Alex has an inflammatory bowel disease like Crohn or ulcerative colitis, his immune system has been compromised, right? Like it's something more than just food, than just gut. So it's going to be hard for Alex to get back to normal, even if it's possible. He might be able to live without flares for a long, long time, but that's usually a lifetime condition. Whereas if Alex has a gastric reflux, let's say, he's been overweight for the past 10 years and he's been taking omeprazole, IBP. Um, as soon as he gets in shape and he starts like eating better, having dinner earlier, etc., he'll feel better. He might be able to even get back to normal completely. So it really depends on the condition and how acute or chronic it is.
Okay, so on that note, for example, as you already know, this is also a trick question for you. I'm sure that you being involved in the healthcare system, so I think you probably have much more information than us on that aspect. But are there any kind of new techniques or new medicines or new, anything, any novelty on that aspect that is there to help people like us, people who are suffering from digestive issues, so they can be anything that to a support system to, so
Hmm.
anything that you have heard new from the last couple of years?
Oof, there's a lot. So there's a lot going on. Things, as you very well know, take time for us as doctors to start using it. It seems something is discovered until we're able to use it in our office might take 5 or 10 years of delay. So there's things that are happening that are really changing the digestive tract paradigm uh, completely. Like for example, in IBS, we are lately discovering that many how do you say it in English? There's a bacterial involvement, like an overgrowth of bacteria in certain places of the digestive tract that play a big role. Or for example, in the gastric reflux, there's aspects like how much protein you're eating. So with regards to how your stomach can get better, there's definitely dietary patterns that we're getting to know much better than before that can change the situation completely. With IBD, it's harder because it's a more, let's say, profound condition. Since the immune system is compromised, the symptoms can be in the body too, not only in the gut. So you might have a skin condition or a joint condition. In this case, I think it's more difficult. We depend more on the medication, on the digestive tract specialist. I think it's more difficult to do it. There's less discoveries outside of the medical world, let's say.
And this is the question that probably will, many people will ask you, and I'm sure that our viewers and listeners will resonate. How do you keep your habits, especially when you have a social outgoing? So for example, as you were mentioning, a wedding, or not only a wedding, but if you go, as you were mentioning, the Spanish tapas, or like on
Friday
Sundays
night.
for beers. Exactly. How
Yeah,
do you
yeah, yeah.
manage that? Because at the end of the day, people will say, I mean, what can I do? I have to go with my friends and I want to have a couple of
Mhm.
drinks with them, or have like a pizza, like little bit of junk food at the weekend. So how
Totally.
how do they can manage with that?
Mm. To begin with, you definitely should do that. It's paramount for your mental health to go with your friends, forget about life for a while. Uh, but you should be very strategic about it, because you have a weak spot. Other people don't, but you do. So you have to pick well what you eat. So, for example, if you're going to tapas, I usually give my patients a list of pinchos that will be better for them, but it's easy. You might not take the ones with so much bread, or you might not take the fried ones. It's pretty simple. Or if you, for example, have a, let's say, a wedding or a big party, you can prepare with certain supplements. There's enzymes that will help you with digestion. You definitely should be able to fill up your body a bit. So if you're in the middle of a flare, or if you have a tough situation and you feel that you're not in shape, let's say, in the right moment, I think you should also be able to say, hey, today, even though I'm going out, I'm not eating as much. You should be able also to balance that. And then there's then many little options, like, for example, wine instead of beer can help people quite often, since beer has more gluten, it has more sugar, or yeah, this sort of little things. You'll end up finding what you can do, like the pinches that I was telling you, what works best for you.
I'm sure that our listeners and viewers will be glad to hear that. And coming back to us, as we are left with our final two questions. As you already know, at MiMIAT, we are soon launching our app that helps you to track your symptoms, your diet, and your lifestyle. And you can personalize the experience by yourself depending on the condition you have. So, which role do you think that this app has when it comes to habits? As it has been our the key element and component of this podcast and this video. So which role do you think that MiMIAT will play in building good habits?
Hmm. I think it's going to play a pretty big role. That's why I'm involved. Otherwise, I wouldn't. Because I think it's an app that it's targeted for digestive diseases. So my colleague Dr. Roca and me, we are looking at many studies that, for example, Roma 4 criteria in IBS, or the IBS severity score. Like, the app has all this ingrained, this medical knowledge, let's say. At the same time, I think it's quite, well, it's not out yet, but it seems to be quite user friendly. So pretty simple to use. Um, yeah, I think it's going to be great for you to not only record your habits, but to get ideas from them, to correlate them. So maybe through the app, you discover you have bloating, especially when you have too much coffee because you're sleeping poorly. So all these correlations that you might not be able to do on your day to day, because habits are, as we were saying at the beginning, mindless, automatic. I think the app MiMIAT will be able to show you this, and the potential of that is amazing. And if you combine it with the fact that your own how do you say, your own doctor or your own physician will be able to see your habits if you give him permission for it. That's just amazing. That's really nice. It will help you it will help him understand you better. So I think that's great.
Yeah, that was the question that I was going to entail. You as a professional, that I mean, now not being our CMA, our chief medical advisor, but rather than being Dr. Pedro as an independent professional, how do you think that this app can help you as a healthcare professional? Mainly because at the end of the day, our approach is data driven. So, which kind of benefits do you see for yourself, for example, especially monitoring these kind of patients?
For me as a physician, you mean, not as a
Yeah,
patient?
exactly.
Hmm. Well, I'd say out of experience that people are pretty bad at remembering. Even myself, ask me what I had yesterday for lunch, I'd struggle. And if you asked me 2 days ago, I wouldn't be able to tell you. So I think the app allows me to look into the lives of the people much better, with a much more precise and complete view. And in this way, it will help me guide them, guide each person to their health, and allow them to get better, to find their triggers. It's really a game changer.
We are glad to hear that, and hopefully MiMIAT can be launched soon. So not only
Hopefully.
our fantastic group of community, but also you healthcare professionals are able to take decisions much more based on data. So you are able to give much more precise diagnosis and also much more precise recommendations too. So final question for you. This is much from your heart to the heart of our community. Which tip, advice, or any kind of message that you would like to give to our MiMIAT community? Especially the first two videos received a lot of love in YouTube. So what message does our CMA have for the community, especially not only for the habits, but any kind of suggestions you would like to give them.
Um, it's an honor to be able to say this, but for me, I would say it's not something new, but the idea that there's no two diseases alike. So one IBS in one patient has nothing to do with the IBS in another patient. And this is a key concept that we must not forget. So I think my message would be to try to understand yourself and your disease as much as possible, because it's your own, and you have your triggers, you have your problems, you know what's not working and what is. And the more you know about this, the closer you're getting to the healing, to getting better. And this work is something only you can do. No physician, no one is going to do it for you. They might help you, guide you, but the main job, which is to know yourself, to know your body better, it's a job that you must do. So I would encourage people to not to conform, not to just, yeah, I have a weak stomach. No, you don't. You have right now a weak stomach, but you can get it better. Find whatever is not working and fix it, and you'll feel so much better. I think this would be the message.
That is great to hear, Pedro, and we are super thankful to you to come here today in the first episode of Coffee with Experts, and I'm sure that our viewers will be extremely glad to see you first time, in society as our CMA, our Chief Medical Advisor, and moreover, all the insight that you have given them regarding habits and digestive health. I think it will help them a lot to make better decisions. So again, a big thanks to you and to our community. Here's Pedro. Here's our CMA. So thank you. Thanks a lot, Pedro.
Thank you so much, Suraj.
So a big thanks again to our CMA Pedro for bringing us insight regarding the importance and role of habits in gut health. And to all of you, to our MiMIAT community, thanks to you as well for actually supporting us and for viewing this video and the previous ones as well. So we reached to the end of this very first episode. Please subscribe to MiMIAT's channel, like, comment, and share with your beloved ones. Take care and bye bye.